So Jeff, I would like to ask you, I've been hearing a lot about D3 and vitamin D3 versus vitamin D. And I'm not the best at explaining that. And so I had asked you and you said, yes, you had a way that you could explain it. So can you tell us the differences? And I know we've talked about vitamin D ever since COVID started and how that can support the body. So I think this is something people are really looking into and would like to have a better answer for. So
Sure.
take it away, Jeff.
Just going back to the days when they were discovering vitamins, they were able to scientifically break down foods and extract certain individual chemicals. And then the one that's in the first test tube is D1, and when the second test tube is D2 and third, and so on. And that's all the different B vitamins got named. All the which test tube was it?
Okay.
So that's what the number means. It's nothing like there's three of anything in that particular molecule.
Okay.
So general version vitamin D was broken up into three main segments. The two that then become nutritionally important are 2 and 3. D1 is really not very active. D2 is a little bit more towards immune enhancement, more directly involved with the idea of being able to stimulate T cell production. Now, D3 has been noted for a longer time to be more of the let's absorb nutrients version. The focus here has been especially on calcium. And so this is why they fortify milk with vitamin D. That would you would absorb more calcium into your cells. But the research since that time of let's divide it up into the little test tubes. I mean, that was way back, anywhere from the 19 teens to the maybe 1940s when they were looking at all this stuff. That's kind of ancient technology at this point, um, in ancient history. So what we have discovered since is a plethora of new studies looking at vitamin D in all of its forms, with D3 principally, that talks about immune enhancement, but also mood regulation, pain regulation, the antioxidant regulation of the body. And then absorption of nutrients beyond just calcium. Vitamin D plays a role in hormonal production. It plays a role in neurology in big ways. You literally can't find an area of the body that doesn't have some mechanism of interfacing with vitamin D. But the thing about vitamin D that then became very interesting to me is that it actually isn't much of a vitamin, meaning that in terms of its molecular structure and its behavior and how it interfaces with receptor sites and what receptor sites it hits, it's a lot more like a hormone. And so there's this idea out there that there's this RDA recommendation for here's how much vitamin D you should take a day, which is 500 international units. Well, this is well before the more recent studies, and there's a movement within the nutritional world to get that updated well beyond 500 units. But when I look at that, and people are trying to ask me, well, how much vitamin D should I take? Well, say, well, if vitamin D is indeed like a hormone, and let's just switch that to insulin now. So if you're going to consume a whole bunch of carbohydrates, you're going to actually stimulate the production of more insulin based on the body's need. Less, but if you're that keto person, you hardly eat any carbohydrates at all, you're hardly going to produce any of that insulin. So it's not so much exactly what you put in, it's how much are you using? How much of it are you burning up in your physiological processes? Diverse number of those things that would say your D is being burned up, you burn a candle both ends D wise. Well, then you're going to need to take more. Then there's the idea of those people who maybe don't need as much. Well, they would need to take as much. And so having one standard international unit amount for nutritional, recommendation seems kind of silly once you understand all of that, right?
Well, and
So the way of measuring this, the way that we're going to take a look and are you getting enough D, question mark, would be to do a blood test. And a standard version blood test with a vitamin D add-on, it's very inexpensive, very easy to do, commonly measured. It's pretty good test at this point. And I wanted to share with you the idea of when a nutritionist like myself looks at vitamin D and the levels in the bloodstream, there's a big discrepancy again, from the older science that the labs and the hospitals and clinics and medical doctors are looking at in terms of what they think you need for vitamin D versus here's where you really should be. So I'll pull this up and show you a very good article published by Dr. Alex Vasquez. I'll go to the top. If anybody wants to look up this article, they're very welcome to take this information and download this. Dr. Vasquez also has a video embedded within this article where he talks about vitamin D and especially where it concerns our immune system. But I wanted to come back down here to page 5, which is going to tell us about the idea of vitamin levels in the bloodstream. And let me start off by prefacing that most labs, most hospitals and clinics, when they evaluate vitamin D, their normal range is between 30 and 70. Okay. 30 and 70 is what they typically would recommend. And I recently had a woman come in and her levels were about 90. And they said, oh, you're vitamin D toxic. We better get your levels back down to 30. Okay. So let me then review the more recent information about how vitamin D acts in the body. We have here the optimum range from 50 to 90. This is where new science has determined in a blood test 50 to 90 is the best range for a human being to be in. Below that, if you're anywhere below 50 down to 40, I'm sorry, down 50 down to 40, you're still sufficient, but you're going to have less lifespan. You're going to decrease your lifespan and you're going to have more depression. Then, if you are anywhere between 30 and 40, you have increased mortality, and it's very marginal in terms of how much you're going to use. And remember that each individual is burning up different amounts based on their needs. Anything below 30, and you're insufficient, and you're going to have more respiratory infections and increased mucus production in the lungs and so on. So on the high end, super physiologic means anywhere up to 100 is actually okay. Now, that may over time become things we need to take a look at hypercalcemia, where the vitamin D would be pulling so much calcium into a tissue that it might cause that tissue to become either hypercontracted or start to calcify and get hard and crusty versus pliable and flexible. So that's something that can happen. We would want to do this vitamin D test on a fairly regular basis, about every 3 months, just to track this with somebody who's on a high D supplementation. And then, potentially toxic if accompanied by hypercalcemia up to 150 in the lab range. Now, that's only if hypercalcemia symptoms are occurring. That doesn't necessarily have to occur with that person who's using their vitamin D a lot. And then with advanced disorders, you would always want to be under the care of a physician here. And again, routinely measuring, you can have levels anywhere between 2 and 300 where it comes to an advanced need for vitamin D to benefit your immune system, to control immune responses, especially in autoimmune disorders, and to look at support for your immune system to actually perform apoptosis.
So
So all of these things
do
are well
that as
documented.
an IV? Would they do that as an IV then, if there's that high?
Probably not. You can actually accomplish this by oral supplementation better
Okay.
than IV, although IV wouldn't be a bad idea. But honestly, you can just do a sublingual liquid vitamin D and get the levels that high.
Okay.
Now, again, you'd certainly want to be under the care of somebody who can track this for you and make sure you're not going into hypercalcemia.
Right.
Now, the average person listening to this, your levels can be very, very nice up to 90 and no problem. But below 50, you're actually putting yourself at risk for increased mortality and increased disease processes, mental, emotional, physiological.
Now,
So
when
again,
they test this at the doctor, is there any, I've heard that there's some kind of discrepancy with what the actual levels are and what the test shows. I'm not.
well, yeah, I mean, and there's the was it the 25-OHD3 cholecalciferol, but I mean, at this point, I wouldn't worry about it. Most labs are only running the good ones.
Okay.
If you come to me, you're getting the blood lab measurement that is the actual levels in serum versus there's an older test that I don't think anybody really performs anymore
Okay.
that would not be accurate. But I think that's unlikely somebody's going to get that
Okay.
if there's even reasonable competency.
Okay. All right. And actually, if you wouldn't mind sharing the link, then I can put the link um,
Certainly, yeah.
with the recording so that we have it.
And I'll put it there if anybody even just wants to write it down. The journal entry up here is a link that you can go to, and he's got lots of these,
Yeah.
uh, both videos as well as the written information, and he's quite emphatic about how the medical model has sort of lagged behind in terms of the information they have, and then unfortunately being that far behind or giving advice to people that's not up to date.
Yeah.
So he's very emphatic about we need to catch up on this, and levels need to be changed. The standard dosage needs to be changed and ramped up. He's saying that the 500 IU's is not even enough for a child, much less your fully functioning adult. And again, you take that person with some immune need, and their need is increased, and so you can't just have one patent number that you can apply to everyone.
Right.
How much are you burning it up? What is your need for immunomodulation? That's going to all play into how much D do you use.
Okay.
Now, in when we start talking about then applications of how people would take the stuff, obviously the MVP is the primary and I think the only source of D within the DoTerra product line.
Nope, it's in the
Well,
Yarrow.
the Europalm capsules too, yeah. Okay. So between those two things, you're still not going to get the super physiological level. It's going to, you would have to take ridiculous amounts, well and above the suggested dosage, to ever boost your levels past 90. I mean, you're simply not going to do it by daily supplementation.
Okay. Okay. All right.
I've had people on 20 to 30,000 units a day for months, and they still can't get their levels above 90.
Okay.
Now, again, that's the person with autoimmune disease, which I specialize in. So that person's burning it up more. Now, the average person, again, we want to monitor this. We want to take our blood tests every 3 months or so, and we look for symptoms of hypercalcemia. But I have not yet found anybody who can't take much greater doses than the RDA.
So, can you explain why someone with an autoimmune needs more?
Because your immune system is making a mistake. It's misidentifying your tissue for something that it should kill. That's sort of the basic nature of autoimmune disease. And it's a lot of the T presenting cells, the T regulatory cells, that are responsible for saying, oh, let's identify this, let's figure out what this is, and determine whether it's native or foreign. Vitamin D helps you manufacture more of those kinds of cells, makes those cells more competent and accurate, so that then you're not misidentifying.
Okay.
That's the big mechanism there that vitamin D performs. It does perform also in terms of decreasing overall killer cell production. And so, weirdly enough, it enhances the immune system against something like viruses, but it decreases the amount of inflammation you incur, which is a rare circumstance that somebody could do both.
Okay. Okay. And then the other question, so hypercalcemia is where you're saying it draws, it's leaching the calcium from the bones then? Is that
Well,
correct?
maybe not, but what it's doing is it's pumping extra calcium into cells.
Okay.
Now, that if that's a muscle cell, that's going to be cramping. Well,
Okay.
let's say that's your kidney cells. Maybe you're going to get stones.
Okay.
Okay. If maybe it's your neurology, that might be where you start to have lack of neural transmission. You might not be moving information from here to here because there's too much calcium in the neurosynaptic gap. There's all kinds of things you'd look for, but basically hard and crusty versus soft and pliable.
Okay.
That's the general profile.
Okay. All right. Well, thank you.
You're very welcome.